Hello, and thank you for joining me for working with post-traumatic stress disorder. So I'll address post-traumatic stress disorder, PTSD, and C-PTSD, complex post-traumatic stress disorder. My name is Dr. Parker Wilson, the clinical director of the Awakened Mind Institute. So what is PTSD and C-PTSD? It's a good place to start. PTSD occurs in some individuals after an exposure to life-threatening circumstances. Combat, being a victim of a crime, serious accident, anything where they thought their life was in danger and they thought they were going to die, natural disaster, so on and so forth. Complex post-traumatic stress disorder, C-PTSD, occurs in a small percentage of people with PTSD, and this just means that they're treatment resistant to some extent. The usual talk therapies, cognitive therapies, and med regimes don't work quite as well on these individuals, and so they're a little more difficult to treat. So the fundamental mechanism of PTSD is a glitch in the fight, flight, freeze mode. Those are the three responses to trauma we have in our biology. In essence, those with PTSD have trouble remembering a traumatic event without reliving it. So they remember it and relive it, essentially. So their body goes through it again, their mind goes through it again like it's actually happening again, the trauma. So working with post-traumatic stress disorder, there are two basic kinds of trauma that we have. There's acute trauma, there's developmental trauma. So acute trauma happens usually in adulthood. It's a one-off instance. It's a natural disaster, terrorist event, combat, victim of a crime, like we said before. Some situation where you thought you were going to die, but otherwise the person has a relatively normal, non-traumatized childhood and adolescence and adult life. Developmental trauma is quite different. That means the trauma occurred during the development of the child. So somewhere in that very sensitive period of childhood and adolescence, the trauma occurred. Usually it occurred at the hands of somebody the victim knew, and usually it occurred across time, across years sometimes. Acute trauma happens very quickly by comparison usually, and it's usually at the hands of a stranger. So acute trauma is far more responsive to treatment than is developmental trauma. It's easier to treat, mostly because the person has a normal development to fall back on. They have a non-traumatized frame of reference, so they know what they're trying to get back to. Someone with developmental trauma, on the other hand, doesn't have that frame of reference. All they know is trauma, and so really all they know are the symptoms of PTSD in a way from the time that they're small children sometimes. And so trauma becomes their normal, and the symptoms of PTSD and being traumatized and anxiety become their normal bread and butter. That's their normal state that they get used to. So, begin the treatment process by determining a valid diagnosis. The patient has to agree with the diagnosis, has to make sense to them, and they have to be intimately involved with the symptoms and understand their symptoms to discriminate their symptoms accurately. So we have to go through that process. Once we have a diagnosis the patient agrees with, treatment moves into building awareness around the symptoms and the severity of the PTSD in question. So any numbing out going on with drugs and alcohol has to stop. Treatment moves in the opposite direction of one's intuition. So when you feel like closing, you decide to open instead. When you feel like masking, you decide to be authentic. When you feel like leaving, you decide to stay instead. Treatment very much feels like taking a risk for the trauma patient. So when you want to run screaming in the other direction, you just don't. When you want to numb out, you just can't. You sit with it instead. You get to understand it. You invite it in for tea. I mean, the trauma and the anxiety. You invite it in. You got to get curious about it. So here's what normally trauma patients do. They numb out their emotions, their afflictive emotions, in one of three big ways. They can numb out with drugs and alcohol. That's the first big exit door. Also food, sex, television, money, anything, video games, you can numb out with anything. Second big exit door is anger and aggression. This is a big one for PTSD. Starting to get mad at the people, places, and things around us. We blame them for how we're feeling. We project what we're feeling onto them, blame them for it. They're the cause of this feeling. And now that I have an object of blame, it's very easy for me to get aggressive with them, and I feel justified in doing it. So this is me just externalizing and projecting my anger onto other people and holding them accountable for it. Now that can be done very overtly, yelling and screaming and hitting. It can be done very passively with manipulation, getting weepy, walking out of rooms and things like that. Next big exit door, last big exit door is materialism. So this is just retail therapy, try to buy our way out of it, try to buy our way into better feelings. We can do this so much that we start getting materialistic about people, even want to upgrade our model of husband or wife, and start getting materialistic about human beings. You can go to the extreme. So if you're going to be in treatment for trauma, you have to start creating a lot of awareness around these exit doors. Because, again, what we're talking about is moving in the other direction now. Instead of exiting, we're going to stay. I want the patient to understand their fear. I want them to understand their anxiety. I want them to get curious about it. Like if they close their mind and let their anxiety take a shape in their mind's eye, what shape would it take? If they could talk to it, what would they say? If they could smell anxiety, what would it smell like? If you could taste anxiety, what would it taste like? You've got to get to know it. You've got to stop running away from it and numbing out and projecting on other people and buying your way out of it. You've got to turn around and get to know it instead. You've got to have that much courage. And that's a huge part of the treatment for trauma. So the 8 mundane concerns here. These are just a little relativism here, like what do we do and not do to get pleasure and to avoid pain? What do we do and not do to get material gains and to avoid material loss? What do we do and not do to get acceptance socially and to avoid social rejection, or to get praise and to avoid blame? If we look at our motivations for doing and not doing, saying and not saying, it can really help us understand why we're doing things, get down to the motivation, the core roots of things. This is fundamental for a trauma patient. You have to understand why you're doing something and take responsibility for it completely, so you can be as clean and as authentic as possible. It's a huge part of it. Also, compassion is a massive part of PTSD. PTSD is characterized by anger, a lot of wrath, a lot of acting out typically, increasing levels of anger and anxiety, decreasing levels of compassion and kindness. So treatment works in the other direction. We're going to increase the levels of compassion. Using this list right here, these are all the universal human sufferings that the Buddha talked about. If you're a human being on this planet, you will suffer in these ways. They are very, very predictable. Birth, aging, sickness, and death, being met with unfortunate circumstances beyond our control, being separated from people, places, and things that we want, and the fact that everything in our life is utterly impermanent. We all suffer in these ways. It is possible for the trauma patient to have compassion for themselves, which is a very difficult thing for them to do based on this list. It is possible for them to have compassion for other people as well. It is possible for them to start wrenching their hearts open, to start knowing the anxiety, getting curious about the anxiety, sitting with the anxiety. And when you stop avoiding anxiety, anxiety gets smaller. That's the key. When you confront anxiety and you confront it in the right way, meaning in a dispassionate way, in a detached way, an objective way, you look at the anxiety and you ask it questions and you want to know it, it will begin to respond to that. It will begin to fall away. It will begin to get smaller, the anxiety. Your experience of it it'll become easier. You'll be able to control the anxiety instead of the anxiety controlling you. All you have to do is figure out how to do it the right way. And it's counterintuitive again. So here's a little equation that's very useful to think through. S is the suffering that we all experience in life. P is the pain inherent in life. That's the list that we just went over here. Birth, aging, sickness, death, unfortunate circumstances, so on. And R is what we resist, how we resist in life, okay, how we resist that pain. So you can see from the equation, the more I resist the pain inherent in life, the more my suffering becomes. So if I'm doing a lot of numbing out, going back to this list, if I'm doing a lot of anger and aggression, if I'm doing a lot of materialism, I am out of step. I'm out of balance. This equation is out of balance. R here is going to be like 2, 3, 4, and it's going to double and triple and quadruple my level of suffering in life. On the other hand, if I can minimize my resistance, if I do very little of these things, not numbing out too much, not a lot of anger and aggression, not a lot of materialism, but I do a lot of meditation. I do sit with my emotions quite a bit. I do get curious about them. I understand them quite a bit. Then, on the other hand, my suffering becomes quite small. So if R is 1/2, it cuts the pain inherent in life in half. So the suffering you experience is half what it would have been. Now, this is a real valid way of thinking about it, by the way, too. So consider that. So how much do you resist the pain that's inherent in your life? How much easier would it be if you could simply accept the reality that there is some pain inherent in this life, again, birth, aging, sickness, and death? Yeah, okay. So moving on, core meditations for PTSD. Shamatha is a Sanskrit term, stands for calm, abiding, or single point of focus. There are 3 basic stages. I only teach 2 of them to trauma patients usually. Settling the body in its natural state is stage 1. Settling speech in its natural state is stage 2. There's a lot of instruction in these meditations, and a lot is expected outside of session. Trauma patients have to do a lot of meditating, a lot of introspecting outside of session. And shamatha is a core component of that. Another huge technique, shamatha, by the way, creates mental and physical stability and relaxation. It's according to the Buddha, and that's been verified by modern cognitive neuroscience. Very, very true. That's why we use this meditation. Tonglen, another powerful Buddhist meditation. It's translated as giving and receiving. It's about taking suffering and turning it into the remedy of suffering. So it's about, for the trauma patient, taking anxiety, taking overwhelming anxiety and fear. And you begin, when I feel those things as a trauma patient, I'm aware of it, number one. I'm aware that I'm getting anxious now. And then I'm going to imagine, say in a 5 or 10 mile radius around me, all the sentient beings, all of my brothers and sisters around me, who are also experiencing some level of anxiety or fear. And they're around me. I can feel them, right? There's a big world here. There's a lot of anxiety in our country right now, especially now. And things have gone so off the rails in so many ways. And so I will begin breathing in that anxiety from around me. I begin breathing it in, and I'll see it as a black, sticky smoke, and it's coming in through my nostrils and my mouth, going into my heart center, and it's being changed in my heart center into the remedy. So I'll change it into the remedy for anxiety, which is peace and acceptance. So I'll breathe that out, peace and acceptance. So breathe in the suffering, black, sticky smoke. Breathe out the remedy, peace, is like a white or a blue mist. And I'll actually imagine it going into my brothers and sisters around me in a 5 mile radius and healing them. On the in-breath, I breathe in the suffering. On the out-breath, I breathe out the remedy. This is another core meditation for trauma. Also, Maitri, which is unconditional loving kindness, unconditional friendliness. This is the process of offering joy or happiness. So whenever you see a sunset or a beautiful flower or something really pretty out in nature or whatever, something that just makes you smile and makes you happy, it's the process of offering that to all the sentient beings around you in a very real, powerful way, trying to exponentially multiply the joy and the suffering you feel by giving it to others. So that's called Maitri. It's another core Buddhist meditation. So, pain and suffering inherent in life. Core Buddhist meditations we've been over. I hope this has been useful. I hope it gives you some confidence that trauma can be treated effectively in the modern era. You're free to contact. Please enjoy the website. Contact us if you need any help at all with trauma. We are experts in the treatment of trauma, and we're here to help you. Thank you very much for listening, and I wish you all well.